Mr. Speaker, you were a prominent supporter of the Medicare prescription drug plan that President Bush signed into law in 2003. The Medicare trustees now say that plan is $7.2 trillion in unfunded liabilities over the next 75 years. Do you regret your support for the plan looking back?
No. I think that I am for dramatic reform of Medicare. I chaired the Medicare Reform Task Force, which saved it in 1996 when the trustees said it was going to go broke. And we passed changes which enabled them to say that we had postponed any problem for well over a decade. And I'm very prepared to talk about how to reform Medicare and make it economically viable. But I feel strongly that the number one purpose of healthcare is health. And Medicare was designed in the 1960s when pharmaceutical drugs were not a significant part of how you took care of people. And for us to have a government-run health plan that said, we're not going to help you with insulin, but we'll be glad to pay for kidney dialysis, is an utterly anti-human provision. And so all I was in favor of was modernizing the system to recognize modern medicine. We spend $29 billion a year now, $27 billion a year now in kidney dialysis. So my counter in part would be the right application of modern medicine for the right prevention, the right wellness, and the right management of chronic conditions actually makes the system much less expensive. But that means you've got to take the totality. If all you do is count the cost of insulin, then it's an increase. If you count the ability to avoid or defer kidney dialysis, it's an enormous improvement. And I think we have to look at the system from that standpoint.